A BC woman is sharing her travel health insurance nightmare as a cautionary tale to warn others. She ended up in a Florida hospital and thought she was fully covered until she received a shocking hospital bill months later. With more on her story, let's bring in Consumer Matters reporter Anne Drewa. Anne?
Thanks, Sophie. RoseAnne Timbrell says she had extended health coverage through her work and felt confident traveling out of country, but RoseAnne ended up in a Florida hospital where she received a life-changing diagnosis. But there was more shocking news. It turns out there was a clause in the fine print of her health insurance policy that proved costly. It was supposed to be a well-deserved vacation. RoseAnne Timbrell and her husband heading to Walt Disney World in Florida to unwind and relax.
Walt Disney World is a great place just to hang out.
The trip was this past February, but just prior to leaving, RoseAnne says she was experiencing flu-like symptoms.
I wasn't feeling the greatest before I went on vacation.
As a precaution before her trip, RoseAnne says she consulted with her doctor about her symptoms and had a blood test, but says at the time there was no cause for alarm.
But I'm still able to go to work, so if I'm able to go to work, I think I'm able to go on this vacation.
RoseAnne says she had extended health insurance coverage through her work and felt confident she was covered. But when she arrived in Florida, RoseAnne says her symptoms were getting worse. Eventually, RoseAnne decided to go to emergency. But before she did, RoseAnne says she called her insurance provider to make certain her hospital visit would be covered.
The agent said, yes, you're covered, and you do have extended health for out of country. And I said, okay, because if not, I'm jumping on the next plane.
RoseAnne arrived at the Florida hospital where she received shocking news. She was diagnosed with ovarian cancer.
I guess it was traumatizing. It's not something you would ever think that would happen on vacation.
RoseAnne spent 5 days in the Florida hospital undergoing further testing. When she returned home, her insurance provider denied her claim, stating the expenses incurred at travel were directly related to your unstable pre-existing condition. Within the fine print of her policy, there was a stability clause, which means a pre-existing medical condition must remain stable for 90 days prior to traveling. RoseAnne was hit with a medical bill of $108,000 US.
Just absolutely shocking. I just wish I'd gotten on the plane and come home instead of dealing with all that in the States.
Travel expert Claire Newell says sadly RoseAnne's claim denial isn't uncommon. Stability clauses are often written in standard medical insurance policies.
A lot of people still don't realize that there is a stability period. And in some policies, it's 3 months. In others, it can be as high as 6 months. And it's really important that you read the fine print.
A GoFundMe page has been set up by family and friends to help RoseAnne. Still, RoseAnne hopes her story helps others avoid the insurance nightmare she's still dealing with.
Understand your policy very, very, very clearly because you're having to be your own best advocate.
And we are told by RoseAnne's insurance provider there is a resolution process to dispute her claim if she chooses. That process will allow her claim to be reviewed by a complaints investigator. Again, travel experts warn it's important to read the fine print of any policy, especially around the stability clause, and to ask questions. Also, make sure you request the actual policy. That's not a brochure. That's a full policy with full details of what is covered and what isn't. And if you have a consumer issue for me, you can email me at consumermatters@globalnews.ca.
All right, thanks for that, Anne.